Have you ever wondered about the requirements for documenting an advanced care planning service? Well, in this video, I'll give you some information regarding what documentation is required for that service based on some Cert reviews. So stay tuned. Also, stay tuned to the end of the video and I'll provide you with information regarding our free 5 steps to become a certified marketable medical coder. Hi, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. Just wanted to come on real quick to talk about the latest Cert reviews. And they were looking at advanced care planning, or ACP. And if you don't already know, advanced care planning is a face-to-face service that includes counseling and discussion of an advanced directive. So you had an article from the Mahler Matters. It was MM 9271, and it provided information regarding advanced directive. And it described the advanced directive as a document appointing an agent and or recording the wishes of a patient pertaining to his or her medical treatment at a future time should he or she lack decisional capacity at that time. So Medicare pays for the ACP as either a separate Part B service when it is medically necessary, or as a voluntary optional element of a beneficiary's annual wellness visit. So when a voluntary ACP is performed as an optional element of the advance or the annual wellness visit, there is an explanation and discussion of advanced directives such as standard forms with or without completing the form. So they go through the whole process. They have a face-to-face discussion about what an advanced directive is. They may or may not complete the forms, but having that discussion with the patient is part of this service. This also includes discussing the care the patient would want to receive if he or she becomes unable to speak for his or herself. It must be conducted by a physician or a qualified healthcare professional. Again, it has to be face-to-face with the patient, family member, and or surrogate. So the Cert review contractor conducted a special study of claims with lines for ACP billed with the CPT code 99497, which is actually ACP by the physician or other qualified healthcare professional the first 30 minutes, face-to-face with the patient, family member, and or surrogate. And they looked at claims that were submitted from April through June 2016. The Mahler Matters article states that practitioners would report code 99497 plus the add-on code 99498 for each additional 30 minutes for the ACP services. So they were prolonging this service to over 30 minutes, therefore coding both of these codes. When the Cert reviews a claim, they looked at all the lines submitted on the claim, and then they did a complex medical review to determine whether the claim was paid properly under Medicare coverage, coding, and billing rules. So what they found, unfortunately, was that most of the improper payments in this particular special studies were due to insufficient documentation. And insufficient documentation meant that something was missing from the submitted medical records to support the payment for the services billed. Oftentimes, the clinical documentation was not there to support a face-to-face service where they discuss the ACP. or whether or not the ACP was performed. And then the other piece was the time spent discussing the ACP was also not documented or provided in the documentation to the reviewers. So there are several examples that the Cert provided of some of the documentation that they received when they asked for documentation for this special study. So one of them is a physician billed for $994.97, and in response to the Cert review contractor's request for documentation, the physician submitted the following. They submitted a complete annual wellness visit note for the date of service that documents end-of-life planning discussion with the beneficiary with no indication of a time element. There were other office notes that were submitted and diagnostic reports. So the office note was insufficient to determine the amount of time spent on the explanation and discussion of the advance directives with the beneficiary and or their family and surrogate during that office visit. So again, without documentation of the time spent, the submitted records are considered insufficient to meet Medicare requirements, and the Cert dinged them with an insufficient documentation error. And of course, the MAC or Medicare Administrative Contractor recovered their payment from the billing provider. Another example is where the clinical documentation of the face-to-face service was missing, and again, where the time spent was not clearly documented in the medical documentation that was sent to the reviewer. So they had a physician, and this one actually had some other errors, and we'll talk about that, but the physician billed for $994.97, and the physician submitted the following documents to the Cert. So they sent a progress note from the date of service that documented the beneficiary with chest pain and acute coronary syndrome after a 4-day hospitalization with diagnosis of polymyalgia rheumatic and a history of pernicious anemia. A procedure note for vitamin B12 injection, a hospital discharge note, a hospital admission note, an unsigned cardiolite stress test, emergency room medical records, an order invoice from the date of service showing that an order for an ACP for the first 30 minutes. So the Cert, after receiving this documentation, reached out for additional documentation to this particular provider to support the CPT code bill, and unfortunately they did not receive any additional documentation. Because the provider failed to submit the medical record documentation to support the performance of and time of the ACP, the Cert dinged them with the insufficient documentation error, and the MAC recovered their money. And then the last one is where a physician billed for CPT code 99497 and submitted the following information. There was an annual wellness visit questionnaire dated prior to the date of service, and an office visit note from the date of service that documented does not have a healthcare power of attorney or living will. These were discussed in paperwork given today. So the office note submitted was insufficient to determine the amount of time spent on the explanation and discussion of the advance directives with the beneficiary and or family during the office visit. Again, without the documentation of the time spent, the records were determined to be insufficient according to Medicare requirements, were dinged with insufficient documentation as an insufficient documentation error, and the MAC recouped their money. So the one thing that I wanted to mention about the second case or example, as well as the third, when you receive these requests for records or documentation, it is very important that someone actually compares what type of documentation that they are looking for and provides the detail that they're asking for. So they gave a lot of things that I'm sure was not involved or requested during the time of this review. And you want to make sure that you are providing them specifically the information that they need. So someone should, do a side-by-side analysis of the request and the documentation going out the door before it's sent. Luckily, well, I guess not luckily for them, but they did, reach out and sort of say, hey, this is not it, and ask for additional records. But unfortunately, they didn't submit anything. So again, when if your office receives these types of requests, just make sure that you are validating that somebody is sending the appropriate records to the reviewer. And so what's important about this advanced care planning code and the documentation is, again, there has to be documentation of the actual service as well as the time component that the provider spent face-to-face with that patient, the family member, or a surrogate regarding their advanced directives. That's very, very important.
Question of the day. Do you or your providers code for advanced care planning using CPT codes 99497 and 99498? Let me know in the comments below.
So I hope this was helpful and useful information for you. If you like this video, hit the subscribe button, hit the notification so that you are notified of when we either come on live or upload our videos. And we upload videos every Monday and Thursday. So check us out. If you have any additional questions, I'll post some information regarding the Cert testing as well as the results in the description box below. As always, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. Reminding you to be safe, be kind, and don't wish for it, work for it. Until the next video, take care.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder.